Hi, welcome to the Histology Trial Test on Systems. This is Dr. Byson, EM. You can register for lessons on +260-975-497790 in anatomy, physiology, and all the medical courses. Let's get into this video. Slide number 1 says, what is this slide showing? So if you analyze this slide is the penis. So this is the penis. And then it says what is labeled. The labels F, J, K. So K is the tunica albuginea. So K is the tunica albuginea. Okay. Albuginea. Something like that. Albuginea. And then J is a muscle that is called the corpus cavernosum. So this is the corpus cavernosum. Corpus cavernosa. So in albuginea there is a U here. Albuginea. And then the F, see where F is. This structure here. This is the penile urethra. So this is the penile urethra. Slide number 2 says, what is this slide showing? This slide, you can see, has got a lot of lobes. This is the child's thymus. So this is the thymus for the child. How do I know? The lobes are well differentiated, and the lobes are well differentiated into the cortex, the medullite part, and the medulla, which is the medullite part, and the cortex, which is the outer dark area. So A is the medulla, it is light. B is the cortex, it is dark. And C is the interlobular septum. So interlobular septum. What prominent feature is found in A, which is the medulla? Here you find the Hazo's corpuscle. So the Hazo's corpuscle. Hazo's corpuscle. What is this slide showing? So when you look at this slide, on the underneath area here, there are hair follicles. And then as you are going, the hair follicles cease to exist. So this is the lip. So this slide is showing the lip. And then what are the parts that are labeled A, B, and C? A here is transitioning from a place where there are hair follicles to a place where there are no hair follicles. So A is called the vermilion border. Vermilion border. The vermilion border has got a very thin epidermis, and it is partially keratinized. Thin layer of keratin, and it has a lot of dilated blood vessels, so it appears red. B, these here, these are glands that are found in the lips. So they are called labial glands. And then C is the muscle that is found in the lips, which is skeletal muscle. It is called orbicularis oris. So orbicularis oris muscle. The orbicularis oris muscle is skeletal muscle. That's why we're able to control our lips when we're smiling and when we are frowning. So what type of epithelia is found in A? We said it is partly keratinized, non-stratified squamous, stratified squamous epithelia. So partially keratinized stratified squamous epithelia. This is the epithelia that makes up the vermilion border. What is the slide showing? This slide here is the vast difference. Why do I say it is the vast difference? Because of the thick muscular layer. So because of thick muscular layer. So it has the inner longitudinal muscle. So inner longitudinal muscle. And then on the middle you have a circular muscle. So middle circular muscle and then outer longitudinal muscle. That's the way it is. And then the lumen also, it is irregular. So irregular lumen is the other reason. Irregular lumen. Lumen. Let's move. What is this slide showing? So this slide, you can see there are a lot of follicles. There's a follicle here. There's a follicle here. There are follicles here. These cells that are found close to the follicles, outside the follicles, those are called the parafollicular cells. And the follicles are filled with this colloid material inside here. So here is colloid material. This slide is the thyroid gland. Thyroid gland. What is the embryological origin of this gland? It comes from pharyngeal pouches. So pharyngeal pouches. So pharyngeal pouches 2 and 3. Other literature will also include 1. So pharyngeal pouches 2 and 3. What is this slide showing? This slide is showing the vermiform appendix. So 1 is the vermiform appendix. How do you know? You can see these clips of Libucan here. So those are clips. And then it is surrounded by this structure here, which are the pairs patches. Pairs patches. The pairs patches are made up of lymphocytes. So what are the parts labeled A? Parts labeled A, these are the pairs patches. Pairs patches. Or simply you can say these are lymphatic nodules. Lymphatic nodules. What type of cells are in the pairs patches? The lymphocytes. Abundantly, the T lymphocytes. Okay. What is this slide showing? This slide is showing the deep clips here, and then it has lobes that have got a lot of lymphatic nodules. So this is showing the palatine tonsil. So this is palatine tonsil. Number 2, what are the parts labeled A? The part labeled A here is a tonsillar crypt. So that is a tonsillar crypt. B is a lymphatic nodule. Specifically, it is showing the germinal center of a lymphatic nodule. What type of epithelia lines A? The tonsillar crypt. A is lined by a non-keratinized stratified squamous epithelia. So 3 is non-keratinized stratified squamous. Epithelia. What is this slide showing? You can see this part here, which is labeled A, is pale, and then this part that is labeled B is stained. So this slide is the pituitary gland. This is a pituitary gland. The parts labeled A. A is the pars nervosa. B is the pars distalis. What is the embryological origin of this organ? So the pars nervosa and the pars distalis come from different parts. The pars nervosa will come from the neuroectoderm. So the neural plate of the ectoderm. And then the pars distalis comes from the oral ectoderm. So they've got different embryological origin points. What is this slide showing? This slide is the gallbladder. Gallbladder. What is the part labeled A? This is the fibromuscular cord. It is made up of muscles and connective tissue. The types that are found in muscles are simply smooth muscle fibers, and fibroblasts that are found in connective tissue. What is this slide showing? This is the adult thymus. Adult thymus. You can see the fat cells. So these are adipocytes that have infiltrated the lobules of the thymus. So this is the adult thymus. A are simply adipocytes that have infiltrated the thymus. What is this slide showing? This is an elastic artery. So this is the aorta, elastic artery. What is the part labeled A? Tunica media, where we find a lot of elastic fibers. So the type of fibers that we find in A are elastic fibers. What is the slide showing? This slide has got transitional epithelia here, and it has a star-shaped lumen, irregular lumen. This is the ureter. What is the part labeled C? That is urothelium. Urothelium is simply transitional epithelium. So remember what we said, transitional epithelium has got umbrella cells on top, and it has polyhedral cells on the middle. Lastly, it has cuboidal cells on the base. What is this slide showing? So you can see this slide has got a capsule, and then underneath the capsule there is this space. So this is a capsule here. Underneath the capsule there is this space, and then after the space there is a cortex. So this is the lymph node. So one is lymph node. 2. What are the parts labeled A, B, C, and D? A is a capsule. B is a space beneath the capsule. It is known as the subcapsular sinus. Subcapsular sinus. C is the cortex. And then D is the medullary sinus. So it is a sinus in the medulla. It is known as the medullary sinus. What is this slide showing? This slide is the placenta. What are the parts that are labeled X? X is the villus spaces. Okay. So it's called the paravillus space or sinus. H is the villus. The villus. What is this slide showing? This slide is very common. This is the liver. How do we know it has lobules? The lobules there, and then where the lobules are, we find a portal triad here. So we've got a ductile, a bowel ductile, and the portal vein and the hepatic artery. So this is the liver. What is this slide showing? This slide is showing the fallopian tube. So the fallopian tube. The part labeled A, what epithelia surrounds it. In the fallopian tube, we find simple columnar ciliated epithelia. Ciliated, simple columnar. Epithelia that is used to propel the egg by cilia wafting as one of the mechanisms. What is showing? So what is showing here, this is the seminiferous tubule. Seminiferous tubule. And you can see inside of the seminiferous tubule here, that is spermatozoa. So what is labeled A here is simply spermatozoa. What are the parts that are labeled A, B, C, and D? A is just the circumvallate papillae. Circumvallate papillae of the tongue. B is the taste bud on the circumvallate papillae. C is a clipped. And then D is the von Ebner's glands. So the von Ebner's gland open in the clypt here. So they come like this and they open in the clypt of the circumvallate papillae. What is showing? You can see this B here is the arterial, the artery. A is the vein and C is the nerve. So this is a neurovascular bundle. Neurovascular bundle. A is the vein, B is the artery, C is the nerve. What type of epithelium makes up A? So inside it is the endothelium. It is simple squamous epithelia. The simple squamous epithelia is what lines the vein. Let's move on. What slide is showing here? So you can see from here, it is simple, it is keratinized, non-keratinized stratified squamous epithelia, and then as you move, it changes to columnar epithelia. So this is the cardioesophageal junction. Cardioesophageal junction, J here. So you're moving from the esophagus going into the stomach. What is this slide? This slide is the growing tooth or developing tooth. Developing or growing tooth. So this is the tooth here that is growing. And you can see this is the gum, which is lined by stratified squamous epithelia. So this is stratified squamous epithelia there. Then 2 says, what is the embryological origin of H? H here, this is where the odontoblasts are found that produce the dentine. They come from the neurocrest cells. Neurocrest cells. When the neurocrest cells, especially the cranial neurocrest cells, when they migrate, they will differentiate into the odontoblasts, which will go and produce the dentine of the tooth. What is this slide showing? This is the esophagus. How do I know this is the esophagus? Number 1, it has this epithelia here. The non-keratinized stratified squamous epithelia, and then it has this layer of muscle, which is called the muscularis mucosae. After the muscularis mucosae, then you have the submucosa here. Submucosa. after the submucosa, and then you have got the muscularis layer. That's how we know that this is the esophagus. Furthermore, look at the lumen. It is irregular. What is this slide showing? This is the pancreas, both the endocrine and the exocrine. The parts that are labeled A here, you've seen this is pale compared to these acini. So these are pancreatic acini, but this is pale. Those are what we call islets of Langerhans. Islets of Langerhans. What type of cells are found in the islets of Langerhans? We find the alpha cells which secrete glucagon, and then we find the beta cells which secrete insulin. All right. What is this showing? So the prominent feature here is a taste bud. So you can see this is a taste bud here. This is a taste bud. It's made up of sensory cells and sustentacular cells. Sustentacular cells, which are supporting cells. What is this slide showing? This is the parathyroid hormone. Most people do not know this one. Parathyroid gland, rather. Parathyroid gland. A are principal cells. Principal cells. It also contains oxyntic cells. B are simply fat cells or adipocytes. What is this slide showing? This is the larynx. What are the parts labeled A, B, and C? So B here, this is the vocalis muscle. A is called the laryngeal ventricle. The ventricle that is found in the larynx. Then C, these are laryngeal glands. So the laryngeal glands are found this side where the false vocal cords are. And the vocalis muscle are found this side where the true vocal cords are. The type of epithelia that will line the ventricle is the pseudostratified columnar epithelia. That is the epithelia that will surround the laryngeal ventricle. What is this slide showing? So this is the lung. B is the bronchus. C is the respiratory bronchi, or the terminal bronchi. A is simply a blood vessel. So A is just a large blood vessel. Could be a vein. What type of epithelia will line C? It is lined by cuboidal epithelia. Cuboidal epithelia. That's what lines the bronchioles. What is this slide showing? So this is the spleen. Why? Because you can see here the white pulp and the red pulp is here. So the parts that are labeled A. A is the trabeculae. You can see the trabeculae has got the same color as the capsule here. So this is a capsule. It sends septations inside of the organ, and that are referred to as the trabeculae. C is the red pulp. B is this arterial here that is found in the white pulp? This is called the central artery. So B is the central artery. What makes up C are sinusoids, blood sinusoids and cords. So what makes up C? Simply capillary sinusoids and cords. What is this slide showing? This is the adrenal gland, suprarenal glands. C is a zone that is found under the cups of the adrenal gland. This is called the zona glomerulosa. So zona glomerulosa. A is the zona fasciculata. And B is the medulla. Now, close to the medulla, there is another layer that is part of the cortex that is known as the zona reticularis, but we haven't labeled it here. We haven't pointed at it here. In the medulla, you find chromaffin cells. Very important. Chromaffin cells. All right. What is this slide showing? This is the cortex of the kidney. So it's called renal cortex. The part labeled A, that is the renal corpuscle. B is simply the proximal convoluted tubule. The type of epithelia that surrounds the proximal convoluted tubule is the ciliated simple cuboidal epithelium. Ciliated simple cuboidal epithelium. What is this slide showing? This is the ovary. A, here, these that are showing here, those are primordial follicles. B is a big follicle here, as you can see, and it has the antrium. So this is the antral follicle. You can say secondary follicle as well. Antral follicle. What is this slide showing? This is the epididymis. Okay, I hope I haven't switched the Y and the I there. Say the epididymis. Okay, so the Y is supposed to come here. So what makes up, what epithelial lines A? So what epithelial lines A here is a pseudo-stratified columnar epithelia with stereocilia. So pseudo-stratified columnar epithelia with stereocilia. That's the type of epithelia that lines the epididymis. What is this slide showing? This is simply thick skin. You can see the thickness of the epidermis, specifically the stratum corneum. What is this slide showing? This is the uterus. It is non-secreting. So the glands are small and they do not have anything in them, non-secreting. What is labeled H? That is simply the lumen of the uterus. What lines H? The lumens of the uterus, simple columnar epithelia. Simple columnar epithelia lines the lumen of the uterus. What is this line showing? This is the vagina. Why? You can see non-keratinized stratified squamous epithelium, and then the lamina propria has got no glands. So this is the vagina. What is this slide showing? This is the seminal vesicle. Two, what is labeled 8F? So what is labeled F there is simply the crypt of Lieberkühn. What is the slide showing? This is a lactating mammary gland. Mammary glands. And what you find in N is simply milk. It is colloid material. So that's simply milk. The mammary gland is secreting milk. What is showing here is the prostate. So the prostate gland. And what we are showing in N is simply the stroma of the prostate. Y is the prostatic urethra. Prostatic urethra. And K are simply prostatic glands. Prostatic glands or alveoli or prostatic sacs. Okay, so that was the trial test, and I hope this will prepare you adequately for the test that you have coming in histology. It's been a pleasure. All the best in your test. You can register for lessons on the number that is showing on the screen. See you in the next video.